Teva has been looking very thoroughly into technologies to help her create the new frontiers of new medication and new treatment for patients. Recently, senior management from Teva R&D came to Israel and screened about 400 technologies, labs, and met with various scientists from all over the country. They were amazed by the abundance of innovation and talent in the country, and actually came up with agreements with almost 12 scientists, 12 labs, that will help Teva to come with the new treatment for patients. And this is only the first cycle in that process. What we're looking at in Teva is to combine biology and new technologies, bioconvergence, and that actually takes us from the early development stages, finding new molecules, new proteins to develop into drugs, but also throughout the full process of clinical development, meaning even when you go into human and run clinical studies, how to make those studies less expensive and more rapid. We're looking into technologies like quantum computing. We were looking into those technologies. Even infrared technologies that can be implemented in our clinical trials or in our process of drug development. We are looking into databases to combine them in our clinical trials and clinical development opportunities and efforts. And we are also looking into wearable technologies that have many companies in Israel that have an amazing potential and amazing technologies to be combined with our clinical studies. For instance, one of the things we're doing right now in our clinical trials is moving into remote monitoring of the patients, moving into application that can give you data and more information about the patient and the treatment effect of our drugs in those clinical trials. So the combination of technology, the most advanced technology, not coming from biology, and the biology that we are experts in, this combination can give us an advantage in moving forward in treating the patients. One of the things that I can give you as an example is the DigiHaler, which is an inhaler for asthma patients that is combining information and electronic technology to give more data to the patient and the caregiver when that patient is being treated, and this has been approved recently. The other thing that we are looking at is trying to minimize the time that takes us to develop a drug from the beginning to the end. And one of the things we are looking at is how to minimize time by designing the clinical trials in a more efficacious way. Efficacy comes from the combination of new technologies like wearable sensors, like using applications and using remote monitoring in our clinical studies. This runs from phase 1 studies all the way to phase 3 studies and even beyond. What we found is that these technologies are, most of them, if not all of them, can be found here in Israel. And the innovation and the innovative thinking of Israeli scientists combined with our needs and the capabilities that we can find in Israel actually makes Israel one of the best sources to this combination of bioconvergence.